Uneven rollout of Medicaid expansion leaves HIV/AIDS patients in limbo. Vertical line all JZA America. Global header background image URL/content/jam/jcr:/content/header/images top.adapt.960.high.1,378,848,966,637.jpg at media minimum width 768 px and max width 959 px. Global header background image URL/content/jam/header/imageable.adapt.960.high.1,378,848,966,637.jpg at media max width 767 px. Global header background image URL/content/jam/medium.1,378,848,966,637.jpg. Display mobile navigation. Display mobile search bar. News, video, shows, schedule, more shows, sections. U.S. International economy, technology, science, environment, health, education, culture, sports. Trending. Serious war, weather, health, technology. Search form. Uneven rollout of Medicaid expansion leaves HIV/AIDS patients in limbo. By Laura Newman. September 10, 2013, 12 o'clock p.m. In states that aren't participating, thousands could miss chance for expanded coverage. Topics: health, Medicare, Medicaid, politics. Viewed comments. Activists take part in the Keep the Promise Alive 2012 AIDS March and rally on the streets of Washington on July 22, 2012. Activists are speaking out against the high costs and lack of access to HIV and AIDS medication. Mondale and GAN/AFP/Getty Images. William Wilson has one word for what healthcare reform means for him: freedom. 11 years ago, Wilson was diagnosed with AIDS in Chicago. He had health insurance that he purchased as a self-employed graphic designer before his diagnosis. Wilson continued paying his healthcare premiums for a year and a half following his diagnosis, but said his health insurance provider denied the vast majority of his claims. Enormous medical expenses soon forced Wilson into bankruptcy. He says he could not obtain health insurance of his own because of his pre-existing condition. The freedom Wilson talks about is the ability to get many more of his health needs met, obtain insurance without discrimination, and have less stigma attached to getting his health care. Wilson won't have to work around the income limitations that previously forced him to maintain a low income in order to be eligible for existing federally funded HIV/AIDS programs, or live without insurance. Gina Brown, who lives in Louisiana, isn't so lucky. Lawmakers in Wilson's state of Illinois have thrown their support behind both healthcare reform and Medicaid expansion. Those in Louisiana have not. When states don't participate, the federal government will help set up exchanges that some fear will be weaker. The healthcare exchanges are slated to go live October 1 and the coverage will take effect January 1. The healthcare exchanges under the Affordable Care Act, in the states that participate, could see to it that 20 to 30% more HIV-infected people are covered, according to experts. With healthcare reform, also referred to as Obamacare, Wilson will have access to far more comprehensive medical coverage and subsidies for health insurance. Health reform encompasses a full package of benefits deemed essential to his health: preventive services, health screenings, access to mental health care, and much more. For the first time since his diagnosis, his HIV status won't be a barrier to getting insured. Governor's whims. Access to health reform depends on which state you live in, and legislators in some states, particularly in the South and Southeast, and some Republican-controlled states in the West, have balked at healthcare reform, meaning it may be harder to get it moving ahead. Brown, who lives in New Orleans and was diagnosed with HIV when she was pregnant in 1994, is enthusiastic about healthcare reform if it is rolled out correctly. She referenced Massachusetts, when people living with HIV and AIDS became fully insured and infection rates went down under health reform implemented by then-Governor Mitt Romney, the Republican, as a positive example. Republican Guth. Bobby Jindal, in Brown's home state of Louisiana, rejected both healthcare reform